Good morning, good afternoon, ladies and gentlemen, members of the media. Welcome to this media briefing. Is everybody ready? All the cameras ready? Okay, wonderful. Let me start by apologizing for running behind by 5 minutes, but I believe you will understand that we have to quickly finalize a few things. Let me take this opportunity to introduce myself. My name is Foster Mohale. I'm the spokesperson for National Department of Health. Welcome to this media briefing, which is going to be led by Health Council Media Briefing. National Council is equivalent to what they call MINMEC in other departments. So this consists of the National Department of Health, the Minister of Health, Dr. Aaron Motsoaledi, the Deputy Minister of Health, Dr. Joe Parker, and all 9 health agencies in the provinces. But also, we have got a representative from South African Health Military Services. We have got also a representative from South African Salga South African Local Government Association. So without wasting any time, I can quickly take this opportunity to introduce members of the panel who are going to collectively interact with you. I'm on my immediate right-hand side, and in the middle is Dr. Aaron Motsoaledi, the Minister of Health, followed by Dr. Joe Parker, the Deputy Minister of Health, followed by the MEC for Health from the province of Northwest, Bugolibu Prima. We also have the MEC of Health from the MEC of Health from the province of Northwest is MEC Lehari. We've got the MEC from the province of the Eastern Cape, the MEC Kapa. We've got the MEC from the province of Limpopo, MEC Machejo. We've got the MEC from the province of Mpumalanga, MEC Manzini. We've got the MEC from the host province, Ms. Gomora Lohoko. We've got also joined by the MEC from the province with 2 surnames, Honorable Ms. Melani. We've got the Honorable MEC Wagner from the province of the Western Cape. We've got the MEC from the province of Free State, the MEC of Makati. Yeah, just wanted to get the name correctly. We've got also the MEC from the province of Northern Cape, which is the largest province in the country, the MEC Mukwele. So without wasting any time, also we've got the Director General of the National Health Department, Dr. Sandile Buthelezi. So on that note, I'm not going to waste any time. We also have got the senior officials from National Department of Health, senior officials from all 9 provinces. So without wasting time, I'm going to hand over to the Honorable Minister of Health, Dr. Aaron Motsoaledi, to take a lead. But when it comes to the questions, because this is a collective session, all the MECs will participate. Over to you, Minister.
Do I have a mic here or am I using this? Thank you very much, Program Director, my colleague, the Deputy Minister of Health, Dr. Joe Parker, my colleagues, the MECs of Health from all our 9 provinces, as introduced, ladies and gentlemen from the media, good afternoon and welcome to this media briefing. I just want to add that while the program director said this gathering, which we call a National Health Council in Health, is called a MINMEC in other departments, does not only differ in name, it also differ in character, stature, and status, because in the other departments, MINMECs are for coordinating purposes, to help ministers of those departments to coordinate with their MECs. But the National Health Council is a statutory body with decision-making powers, because unlike the other MINMECs, it consists of all three spheres of government: national, provincial, local government, as in SALCA, and the Surgeon General of South African Military Health Services. So that's why it's a statutory body. Thank you for making time to join us today. We will also buy bassinets, which are bed for newborns. They are not necessarily cots. These are for newborn babies, to avoid the cardboard box embarrassment, which I've mentioned. We'll buy 76,525 of them, to the tune of 309.5 million. We will also buy linen, including bed sheets, pillows, and all the other things that are necessary to make patients feel comfortable. We'll buy 1,250,000 of them, to the tune of 273 million. The total cost for this procurement of 1.4 million articles will be 1,346,000,000. That will be the total cost. The other thing we want to report to you, which was widely reported in the media, is the issue of oxygen plants. It is common cause that during COVID-19 period, many health facilities used to run out of medical oxygen, which was one of the mainstays of treatment, by the way. The Global Fund then offered to put up self-generating oxygen plants called pressure swing absorption plants, or PSA units. The Department of Health gave this work to the IDT as an implementing agent, which were to implement in 55 of selected hospitals across the country. Unfortunately, persistent media reports about possible corruption and electoralities in the procurement process continued. Even up to a few days ago, there were still such media reports. The Minister of Public Works and Infrastructure, as the authority to whom the Department of Public Works is reporting, entered the fray and announced that it's going to conduct investigations. Well, some people were fired in IDT for these purposes. As a Department of Health, we support the investigations. We have even asked the President to enter the fray also at his level. And he has agreed. I'm sure you'll announce very soon. But we support the investigation. But we are worried what will happen to the Department of Health while these investigations are going on. After all, this is donor money. And the donors may just get angry and say it's not safe to donate in South Africa because of these allegations of corruption. We were worried about that. We then decided as a Department of Health to remove the project from IDT and send it to the Independent Development Trust under Public Works, and send it to the DBSA, the Development Bank of South Africa, and which reports to the Minister of Finance. And we have agreed with the Minister of Finance to do that. We've met the two senior executives in the Development Bank, and they've agreed. The second policy which you want reviewed is committed overtime, which over the past few days have been making rounds. The issue of committed overtime, which I believe came into effect because it was believed that every doctor needs to be on call at one stage or the other. That committed overtime is being abused, but it's also not being managed very, very well, together with RWAPs. And people might argue then that is because you are poor management or the poor management of the departments of health in various provinces, that RWAPs and committed overtime are not managed well. I just want to remind you, I've just said here, that there's no senior person, especially in medicine, who will agree to take a management position in the department. So the management positions are taken over by junior people. And the people who go to do RWAPs are very senior to them. And so it's very difficult to confront your senior. And that's the problem that we're faced with. You can check in all our hospitals. Whenever we advertise a job for a CEO of hospital, all the senior doctors are not interested at all because of what OSD pays them. But once the junior person agree and take the job, they look at them as junior and they undermine them profusely. And the junior people also cannot confront. You can't confront somebody who is much, much more senior than you and holding a higher status. And for this reason, we believe that's why we're experiencing problems. The third that will be reviewed is the issue of community service. Community service was introduced years back, specifically because doctors were refusing to go to rural areas. They had a wide choice. And as you know, those choices, they are still fighting for them. For instance, when we place interns, I'm sure the media knows it, because people rush to the media to complain. When we place interns, every doctor who have just qualified for internship, they will choose Cape Town in the Western Cape. They will choose Pretoria in Johannesburg in Gauteng, or maybe even some cities in Ikuruleni. They will choose Durban in KZN, and they will choose Bloemfontein in the Free State. If we are lucky, they will choose Kimberley and Northern Cape. MEC, forgive me, but that's true. If we are lucky. We even, yes, or if we are very lucky, they will choose Polokwane, Limpopo. But by and large, Nelspruit, if we are lucky. Okay, yes. But colleagues, jokes aside, there are doctors who are known to have waited for 6 months without a job, refusing internship in rural areas, and wait without a salary. That used to happen, and people might not be aware of it. Now today, every doctor will run for any job that is available. There's no question about it. So why should we relook at this issue of community services? Because it was done to make sure that even rural hospitals do get a doctor at least for a year, at least. Now that is no longer important because doctors will go. We want to review it. The last policy which we want to review, which I heard talking about under correction from the Department of Basic Education, that they've already dealt with this issue, is something called rural allowance, where people were paid extra because they are working in rural areas where there's no tar road, where there's no electricity and they can't watch TV, where there's no clean running water. That situation over the past 30 years have actually changed. I know when I was an MEC of Education in Limpopo, we used to complain about it. Somebody staying right in the center of Polokwane, but working about 30 to 40 kilometers outside Polokwane, which is regarded as rural, earning a rural allowance, but enjoying the stay in a city. Because Polokwane is a city now. It was a small town during that time. So all those things we want to review, and people will be consulted. This team who is allowed to co-opt, especially people with skills, especially from the legal profession, they can co-opt. We encourage them to interact with the deans of our medical schools, who are responsible especially for our teaching hospitals, but they must do their work, and we pray that in 6 months they'll have finished the review. We encourage members of the public to interact with them so that when they give a final report, nobody should claim that they were not consulted. Thank you very much.
Thank you very much, Honorable Minister. Members of the media, as I indicated that the Minister is speaking on behalf of collective, so they're going to share the questions among themselves. We've got the roving mic. Where is it? The mic? Okay. Yeah. We can now pose questions to the leadership here. Let's hear. The first question is the ENCA. Next. You'll introduce your name and the media house you come from. So it'll be number 2, number 3, Newsroom Africa. Any other hand? For now, let's take these 3 hands. We'll take the second round. Over to you, Heidi.
It's Heidi Jonkers from ENCA. Minister, I've asked you this many times, but I'm going to ask you again, and perhaps there could be a clearer answer now that you have all your MECs here from all provinces. But the Finance Minister, during his budget speech, said that provinces have to find money to fill the gap for the funding that is being cut off by the US.
They have to what?
Find the money that has been cut off by the US. So I would like to know if that was at all discussed and how you are going to deal with that. Thank you.
Heidi, are you sure? None of us remember
Yes.
ever saying so.
Yes,
That provinces must find money.
yes, so what he said was that the national doesn't have the money to give help. So provinces within their budgets have to find money to fund these programs if they've been affected by that funding that has been cut off by the US.
Hey, I'm not aware of that. Maybe I missed it. Yes. Maybe
Okay.
let me answer it before you go to the other because
Okay,
very
yes,
important. I'm not aware of that, but I will really be surprised where we think provinces will get the money from. Because nobody, including national itself, we've had a series of at least 3 meetings with Treasury to look at what can be done. We had a series of meetings with international donors, even local ones. All of them have said they'll look into this issue, but all of them made it very clear that they do not have the capacity to replace what America was giving in research and everywhere else, HIV and AIDS. The only thing that we guaranteed and provinces are doing is that nobody who is on ARVs must stop having their ARVs because they are not there. And secondly, that nobody who needs to have ARVs must be told that they can't be provided because of these budget cuts. That's why on the 25th of February, we launched a project to look for 1.1 million more people in addition to put them on ARVs because we were very sure, because we are buying 90% of our ARVs and 10% from Global Fund. Again, on the 24th of March, World TB Day, we announced that we look for 5 million people every year who must be screened for TB and those who are found to be positive to be treated, because we are quite sure that we won't suffer any problems in that regard. Now I can announce to you today that 2 weeks ago, the Global Fund, established more or less at the same time as PEPFAR, the Global Fund to fund the HIV and AIDS, TB and malaria, has given us a permission to order 1 billion rand worth of ARVs. And the DG has already put in that order, 1 billion rand worth of ARVs, which will be put for by Global Fund. I can say without any equivocation that ever since this announcement by the US, this is the first tranche of help that we ever got, the 1 billion rand worth of ARVs. Before that, we have got many promising funds. I don't want to mention him here because promising remains the word promise, and it remains promise, and we haven't got anything. I wouldn't like to put people under pressure to mention them here, but I don't know how our provinces will even try to do anything other than the other, I mean, in terms of providing money. The other thing we have said they must do, which they are doing, is to try and make sure that people who were receiving their treatment elsewhere in clinics that were closed must be taken over and absorbed by our clinics and hospitals. And that is happening. And that wherever there's a shortage of human resources, they must second people to come and do that work. All those things are happening, including the fact that we want people to get a 6-month supply of ARVs, and we want to strengthen the CCMD, the Central Chronic Medication Dispensing and Distribution Program. Those are the things we're doing. About provinces looking for money, I don't even know where they'll get it from, unfortunately. Thank you.
Thank you. Go on.
Refilo Mekwa, SABC News. Minister, my first question is, it was previously reported that over 1,800 qualified doctors are currently unemployed, and today you just mentioned the vacancy of 1,200. Is the department aware of this 1,800, and how did the department come out with this 1,200 number? That's the first question. And then my second one is on the national health insurance. I thought when you mentioned the topical issue, you were going to talk about the implementation of the NHI. Earlier today, the SA Medical Association raised some concerns over the financial feasibility of the NHI plan, highlighting that it would have immense tax burden on SA taxpayers. Your thoughts on that? Thank you.
Refilo, the issue of unemployed doctors and hiring a particular number, I'm sure you are aware that unemployment in the country is much higher than the figures we have mentioned. But we are employing people in terms of our capacity and ability. That's what we're doing. If we had money to make sure that every South African get a job, I'm sure that will be done. But you are aware that things are not like that. So the money we are hiring for 1,200 doctors is what we can afford, given the budget that has been given to us. The issue of NHI, you are talking about SAMA, South African Medical Association, is just one of the few who have entered the fray. Not that we did not expect it. We definitely did. We are still expecting one from a political party, if I'm not mistaken. We have got court cases against NHI from Solidarity. We have already finalized and sent in our answering affidavit in November last year. We have got a case of BHF. The BHF is the Board of Healthcare Funders representing some medical aid schemes, not all, because there are medical schemes like GEMS that wrote to us to tell us clear that they are not part of that, they don't agree with it. And we have got a letter in that regard. But they are members of BHF, but they said they are not part of this court case. These 2 court cases have already been heard in terms of whether what they call jurisdiction in law, yes. And the judge said they will give a ruling in 6 months' time. We're waiting for that. Then we have got another case from the what do you call it? This South African, the specialist.
Oh, yes, private stuff.
Yeah, the private specialist organization. Not all of them, but those who belong to that organization is called SAPPF. Yes, South African Private Professional Forum. Yes, they also have submitted the case. I'm still busy writing an affidavit in that regard. Then there was HASA, Hospital Association of South Africa. We've been given a deadline by the court for which we must submit the affidavit, the answering affidavit. Then SAMA is the latest entry. And I must emphasize, it's not that we didn't expect this. All the people here who have taken us to court, we definitely expected it. And we'll take it as it comes in the court of law about NHI. Thank you very much.
The next one from Newsroom Africa.
Good afternoon, Seneko Mishaba from Newsroom Africa. I've got a couple of questions for the Minister or anyone who can respond. There have been some incidents of attacks on health professionals in some provinces, with the Limpopo province being the latest one, where health workers were attacked inside the clinic. So my question in that matter is, what is the department doing in that regard to ensure that the safety and security for health professionals, not just nurses, but also emergency care services as well? On the issue of the new policies announced here today to be reviewed, were there any consultation with the stakeholders such as unions and affected parties, junior doctors or unemployed doctors, in terms of getting their insights on this particular issue? The issue of funding, Minister, we talked about...
No, wait a bit, Tinyuko.
Oh.
The consultation about what? About these policies?
Yes. Were there any consultation made? Or
Didn't I just mention to you that we have appointed this team to do the consultation?
Yeah,
or you want the consultation to be done by me?
No, I'm saying, Minister, in terms of introducing the idea that you are thinking of reviewing these policies, we will be setting up a team that is going to handle that matter. So were they informed, are they even aware that there's a conversation about the review of current policies? That's my question.
Well, we are announcing it. We are announcing it today, and we believe this team will write to those who are likely to have interest. They will write them letters to come and present. We are not doing any consultations because we don't believe we have got the capacity, the knowledge to do so. The team will do those consultations with everybody and everybody that is affected. We believe if we have to start doing those consultations, it will be very complex. What will happen if somebody says they don't see a need for this team? We see the need, and they'll go and consult. They'll go and put up what they have, and go to read the National Health Act, which I've just mentioned, because the minister has got a right to choose several teams which exist by now, called ministerial committees. We don't consult people when we choose those committees, but they get consulted when there's a change of policy. And this is what these committees are definitely going to do. You mentioned another question, Tenyiko? I'm sorry I interrupted you because I didn't want to forget this one.
All right, it was relating to the issue of safety.
Oh, yes. Yes. Look, I don't know how to answer you because it's on the agenda. This National Health Council still goes up to tomorrow. I haven't yet consulted my colleagues, but I'll only mention something that I mentioned in public. I'm sure you're talking about the nurses in Limpopo who were unfortunately raped. And then you did not mention even patients, because we had the death in Philadelphia, which we reported about. What I said in public is that we are going to ask that the security companies, because these are private security companies, they need to be reviewed to see if they are fit for purpose, especially in view of what we had in Limpopo on those two occasions. And we are going to start in Limpopo with that review. In other words, are the people who are hired there fit for purpose? Are they registered with SIRA? Because every private health security personnel must register with SIRA. And that registration is periodic. I don't know after how many years, but you must register with SIRA. We are going to check that. Secondly, What is their form of training? I don't want to preempt it, but what I was told in Philadelphia Hospital, where this patient was attacked, it left a lot to be desired about the conduct of those security officers. It left a lot to be desired, and we want to know who are they and all that. So that's all I can say, but because it's still going to be debated here, we are not able to announce it yet. The National Health Council still continue after you will have left, which is in a very short while. It's not going to be for a long time become, and tomorrow it will still continue, and we'll be able to report to you. Thank you.
Let's check the follow-up questions. SABC.
Thank you, Refilo Mekwa, SABC News again. Just on the appointed committee, why is the entire team dominated by academics? Does that mean that the minister doesn't have confidence in government officials to interpret the review of the policies? And then the second one, I have a few on this actually. Couldn't the DPCA not be an ideal department to deal with this matter?
Which one?
Of the review of policies?
The
Review of policies. That is the
Yes.
the second last one. Are there no possible conflict of interest to review some of these policies by your newly appointed committee members, given their primary jobs and roles? And then the last one, do you not support Gauteng's measures that they recently announced in putting control on the no abuse of committed overtime by doctors? Thank you.
Thank you. Let me start with the last one. The DG wrote a letter to remind Gauteng of the decision of this National Health Council that there's going to be a review committee, and they've accepted that. That's why they've withdrawn, because no province can make a decision and thereafter we send people to review. It won't look good. It will look like we have already decided and we are doing a review only to fit the decision that we have already made. So Gauteng has accepted that, they've withdrawn. All the provinces, including Gauteng, will wait for this review. Your first question, why not giving it to government officials? We deliberately did that, avoided government officials. Firstly, they've got their own jobs, but secondly, we want an independent reviewer. Government officials have got an inherent interest in this matter. If I ask anyone here or their DDGs what policy must be taken out, they will tell you immediately, because they are telling you about their experience about something that inconvenienced them. So government officials are definitely not the right people to review a policy. We want people who will review it independently. Look at all the facts. Interview even the same government officials, by the way. They are going to be interviewed. If you are a DDG for HR, hospital services, or whatever, they will call you to come and interview you and hear what you're saying. So we can't give it to government officials. DPSA, you mean the Department of Public Service and Administration, even worse. Even worse. Because, yes, for instance, even worse, because some of them have come up with some of the policies, and for us to ask them to review their own policies, they will just say yes or no. We still want independent again. And the Department of Public Service and Administration itself said they might start a process to review OSD. And they've announced that about 8 years ago. They've not yet done so, as far as I remember. So they will be the worst people to try and do this review. Again, we need independent people. Conflict of interest, that's exactly why we're avoiding conflict of interest. If you check here, the academics we chose here are mostly retired academics. They are no longer in this area. But we chose them because they've got experience, they've done this job before. If you look at the person like Professor Eric Boo, he was a dean of a faculty of medicine at University of Pretoria, meaning all the central hospitals in what you call, which are falling under that hospital, that's mostly Stupik. He knows all the problems that were happening. But because they are all related, you will also know where what are the problems. So we chose them specifically because they are retired, but because they've got experiences, not because we don't trust public servants, but you can't call people to review themselves in simple language. Yes, I think I've answered all your questions, which were all related, by the way. Thank you.
Thank you very much. Any last potential question from the floor? Thank you very much for making time for this media. Allow me to adjourn this meeting.
Thank you.
The Minister and the MECs will always avail themselves for the interviews beyond this formal media briefing. Thank you.
Thank you very much.